Mental health crisis can be especially cruel to kids. With little life experience to draw on, they can simply become overwhelmed. On top of that, there's a shortage of child psychologists and child psychiatrists. But that's not stopping care providers from being aggressive in getting an early diagnosis to give kids a fighting chance. There's been an uptick in urgent care visits for kids in mental health crisis.
Dr. Ben Maxwell is a child psychiatrist and inpatient medical director for Rady Children's Hospital.
This year we're seeing 6 times the amount of patients that we saw last year.
Does that say to you in your position that there are more kids in crisis, or is it saying that there's more awareness about your facility? What's going on with that?
Well, I think there's multiple things going on. One, there's more kids in crisis. The prevalence does seem to be increasing for psychiatric illness in kids.
The internet could be playing a role in that.
Social media is also a challenging thing. Although it does have a way to connect people, it also has a way to isolate people, make them more prone to cyberbullying, or the fear of missing out, seeing that everyone else's life appears wonderful online and comparing their own life and possibly not meeting that expectation. A lot of the kids that require our services have problems that they're encountering on social media, whether it's cyberbullying or just kind of an anxiety about who they are and whether they're good enough in this world.
Rady Children's is working to get kids help as early as possible.
You're going to be opening up a first-of-its-kind facility here, I understand?
We're planning on opening a psychiatric emergency department here adjacent to our physical emergency department. There's not anything like this in our region.
From here, a child could be sent to an inpatient facility if necessary.
This will all be renovated. We have plans in place.
In the 12 hours or so a patient is here, they'll get a full evaluation and a comprehensive action plan. Having a 24-hour emergency psychiatric facility for kids is a powerful step, but getting to kids long before they are in mental health crisis is the much more important long-term goal.
1 in 5 children between the ages of 13 and 18 live with a mental health condition. Half of all lifetime cases start by the age of 14. But here's the thing. The average delay between the onset of symptoms and some kind of intervention is about 10 years. That's a huge amount of time where children could be getting help and aren't.
Drastically better outcome. On our inpatient units, when I'm seeing patients, I typically think to myself, if only I could have seen this kid 5 years ago, 10 years ago, I could have intervened and changed the trajectory of this kid's life.
The low supply and high demand for child psychiatrists and psychologists is one of many factors creating a barrier for kids who need treatment. At Rady, they're pushing for new solutions.
We're trying to get a child psychiatry nurse practitioner program going.
Okay.
So nurse practitioners could be part of the solution, social workers can be a part of the solution, psychologists. It's going to have to be a task shifting in order to meet the demand.
The family health centers, like Rady Children's, is being more aggressive, now making it standard to screen pediatric patients for mental health issues.
If they score at a certain level, they're given a referral for mental health. If they score above that, they're given a warm handoff, and a mental health professional actually will come into the examination room and escort them out to their office so they can begin assessment right there.
For many parents, just the idea that their child could be battling a mental illness is terrifying. That fear and lack of understanding is a major roadblock for many in need.
And it's arming parents and caregivers and family members the information that this is a brain disorder.
That's why raising awareness is so critical.
It's nothing you did wrong as a parent. It's nothing that you could have changed the course of when this is occurring. So we're trying to give that education that it is treated just like a medical condition.
So I really want to get out that message. The earlier we can seek treatment for what might seem to be minor behavioral health problems, school avoidance, school anxiety, difficulty with friends, socializing, depression, we can really make a big difference for the kids in our society.
There is hope. People do get better despite some really long odds. One common theme in our stories of recovery is that people suffering in mental health crisis, they can't do it alone. They need help. Maybe that help comes from you, taking direct action to give them a hand, or maybe you could support one of the organizations dedicated to assisting people who are in mental health crisis. But if you need help right now, please call the Access and Crisis Line at 888-724-7240. It's a 24-hour line staffed by mental health professionals. Don't wait, call now. For links to anyone we featured, go to cbs8.com/healing, where this entire show will be available to view again or share. There are many mental health issues affecting our community that we haven't touched on. Everything from our military, both the active duty and veterans, to addiction, to refugees dealing with trauma. There are many more stories to be told, and at News 8, we're going to tell them. Thank you for joining us. For Healing Hearts and Minds, I'm Carlo Cecchetto.